So I'm a graduate of the residency program, and when I graduated residency, I very much went into the job search thinking, I've enjoyed my time at MCW, but I could look elsewhere. I could move on. It might be time to go someplace else. But as I interviewed and I went to different places, the more I saw and the more places I went, the more I was reminded of how great MCW was. And so ultimately that's what led me to stay on as faculty, is that experience of just seeing how well MCW stacked up against all the other places where I was interviewing.
I think the program is very flexible in nature. The character of the program changes with the complement of residents that's within it. Interests of the residents change with each new incoming class, and the goal is to provide a sound foundation core curriculum for them to be excellent radiation oncologists, but then to also allow some latitude at the end of the core curriculum to allow them to introduce some of their own interests, whether that be palliative care, patient safety quality initiatives, diversity in medical education, whatever it is that they're interested in, to allow the program to sort of kind of meet the interests and needs of the current group.
A lot of people will ask me what the strengths of our department are, and I would say by far the strengths are the people. We have great facility, we have great technology, we have great patients, but I think at the end of the day it's the people that makes this place run the way that it does. We also want to maintain this culture that we have within the department and select the right fit that will complement that culture.
Does the right fit have to include volleyball playing?
It doesn't have to, but it certainly helps. Yeah, volleyball playing, maybe a dog too. We're big dog fans here.
One of my favorite things about it here is the people that you get to meet. Sarah's like one of my best friends in the whole world now, not only as a colleague, but also in friendship way beyond medicine. And I feel very supported from not only my other co-residents, but also the people here at this department. And for me, that makes a huge difference in my day-to-day life.
Christina, as she mentioned, is a really close friend of mine. She's my son's godmother even. So it's like really that kind of close-knit outside of work interaction that we have with each other as residents, and then even as faculty too. I have 2 children, and when I had my second baby, I got hand-me-downs from some of the attendings, and they're very nice compared to what I could have on my own resident salary, and they always checked in on those things, and through challenges in my personal life were also very supportive of me. And so that's been nice outside of just learning from them, but also feeling like they care more than just about my education here as a radiation oncologist, but also how that plays into my life more broadly. Since we're not just here to train as radiation oncologists, it's also a 5-year period where life changes a lot, there's a lot going on, and they understand that that's the case, and it's not just 24/7 radiation oncology.
But who's the better volleyball player?
Me.
Oh, Sarah, 100%.
I was volleyball captain in high school of my varsity team, so I feel like
It's a no-brainer.
I won that one.
I've actually never played ever until now, so my skills are lacking. But I'm a good cheerleader and I have fun.
For me, it's really the quality of the people here. I really appreciate my co-residents. My attendings are people who are humble and compassionate, and they're always learning along the way and always teaching you along the way. They have wonderful relationships with their patients. That's always inspiring us as PGY2s to make sure you keep that patient-physician relationship intact and sacred as best you can. It's a really great place, and I'm glad I'm here.
We also have some of the best equipment there is. The MR Linac, a lot of the machines are state of the art, and the people that are training us on them are really wonderful too. I love Milwaukee. I think the fresh air, the people are wonderful. There's no better place to be.
I'm from California originally, so it's a bit of a transition, although I've been in the Midwest for a little while. But Milwaukee's built basically on a lake, right next to a lake, which is really appealing. It's got kind of the appeal of a big city where you've got a lot to do, you've got a lot of good food, you've got a lot of things going on, especially in the summer. Literally every single day, go to jazz in the park or listen to a band while you're kayaking, for example. There's a lot to do, but you don't have kind of all the traffic and all of the, some of the kind of drawbacks of a bigger city.
Yeah, a lot of dog parks and very, very dog friendly. Lots of breweries, lots of different places to get cheese curds.
Who's gonna win tonight?
Volleyball? We're gonna win.
Our philosophy within the residency program is to really focus on high-level clinical training. Our emphasis is to make you an oncologist first, who is an expert in the delivery of radiation oncology. It's always evolving, it's always changing, and it's great to work at a place that's always trying to embrace that change and trying to look for the newest and latest and best treatment for our patients, and to learn and understand and explore that.
It's like a really satisfying blend of like caring for an oncology patient, but having these sort of very kind of high-end, cool tools that you can use to help people.
Like a gamma knife.
Like a gamma knife, protons.
Got it.